We want to invite all the political parties in the province to adopt these recommendations. So while we're launching this today, we're going to advocate for this between now and next June to ensure these priorities that have been raised by Ontarians and healthcare providers are adopted.
The Ontario Medical Association is making dozens of recommendations to address some of the biggest challenges in healthcare. A new report highlights the need to improve wait times, increase mental health services, and prepare for the next pandemic. The association also calls for stronger public health units and more access to home and community care. The group wants to see enough funding to clear the backlog of procedures, ensure proper staffing levels, educate people about healthy lifestyles, and improve data collection. So joining us live tonight is the president of the Ontario Medical Association, Dr. Adam Kassam, family doctor from Northern Ontario, and OMA District 9 Chair, Dr. Stephen Cooper, and Chief of Staff at St. Joseph's Health Centre Guelph, Dr. Hugh Boyd, who's also a care of the elderly physician. We appreciate all of you making time for us, doctors. Dr. Kassam, can we outline those 5 targets here? This is the first of its kind since the pandemic. Can you explain the motivation for this report for our viewers?
Rashmi, we are thrilled to be announcing today a prescription for Ontario, which is Ontario's doctors' 5-point plan for a better healthcare system. In fact, we were at Queen's Park this morning meeting with party leaders in a nonpartisan effort to build upon our healthcare system for the future. And we have 5 major key areas that we are currently seized with and believe are key priorities for the future. The first is reducing the pandemic backlog of care and wait times. The second is addressing the mental health and addictions crisis that is gripping our society and our province. The third is to improve home care, long-term care, and palliative care. The fourth is to expand team-based and integrated care. And finally, the fifth is to strengthen public health, including a future pandemic proofing for our communities.
Mm-hmm. Dr. Cooper, what stands out to you the most? What is the most pressing issue?
The wait times. I mean, anywhere you go across Ontario, patients will come forward and say, waiting to see my specialist, waiting to see my family doctor is the #1 issue. It was an issue before the pandemic, and it's so much worse right now.
Mm-hmm. And how do we begin to tackle that, Dr. Cooper?
It's complicated. I mean, it's not like people haven't been trying for years. But thinking, I think one of the things we've learned with the pandemic is people are sort of much more comfortable with technology about accessing healthcare. We know that's going to be a big part. We also recognize the importance of in-person visits and people getting to see their clinicians, how important that is. So figuring the right balance, the right persons too, making sure that they have the right skills. So ensuring that those are the kinds of things that I think will help address some of those issues with reducing the access. And in addition to putting resources, i.e. money and personnel in the right places.
Right, yeah. Dr. Boyd, out of those 5 points, what would be the most pressing where you are?
I'm a care of the elderly physician, so my head is very much focused on home care, long-term care, and palliative care as being the big 3 crises. And I am so thankful for the phenomenal consultation that happened because people, families, they're crying out for these major priorities as well. It's not just the caregivers themselves. So really thrilled to see these being major priorities with the Ontario Medical Association. And we've got some really simple, what I consider to be easy fixes, and we've got some bigger system change, culture change issues as well. I think these are solid prescriptions. They're evidence-based, they're values-based, and I think they're going to not only just help fix our healthcare system, but really improve the health of our citizens and of course to help the economy become even stronger than it was before.
Mm-hmm. Dr. Kassam, how was this all received, the micro and the macro, at Queen's Park today?
Well, I think what we have learned through the pandemic, Rashmi, is that healthcare is a top priority. What Dr. Boyd was just saying, that we can't have an economic recovery without a healthcare recovery. We know that a strong, robust, and effective healthcare system is important not only for patients right now, but into the future, for future generations. And so I think there has been a collective understanding that a collaborative approach to the future for transformation of our healthcare system is important, is necessary, and we had a very good reception today at Queen's Park, and we're going to continue to advocate over the coming months and years for all of these recommendations to be adopted.
It must have been a real eye-opener for politicians, though, Dr. Kassam, to hear about the backlogs and how long it will take to clear them from the pandemic. Do you have a timeline?
Well, Rashmi, 20 million points of care have been delayed as a result of COVID-19. That's someone's hip or knee replacement that's gone delayed. It's someone's cataract surgery that's gone delayed. It's someone's cancer screening like a colonoscopy or a mammogram that's gone delayed. It's access to primary care, palliative care, and other kinds of care services. And so the sheer magnitude of the issue that we're faced with is a significant one, and it's going to require an all-hands-on-deck approach by the profession and other stakeholders, including government, healthcare institutions, organizations, and communities.
Because you can only work so much, right? Dr. Cooper, we heard that the efforts coming out of this pandemic in this endemic stage, which we're not in yet, would be working 120%. How would you characterize the situation for frontline healthcare workers right now?
Well, they're burnt out. I mean, they're tired. I just finished my ER shift, and I know that people are looking forward to the end of the day. And it's hard to be a compassionate healthcare provider when you're worried about your own mental health. So it's going to be. I'm glad I'm not the person in having to make all the big decisions, but we can certainly see where those sore points are for both for providers and for patients.
Yeah, and mental health care, Dr. Boyd, is essential for those in long-term care, but also their families as well, who have really stepped up during this pandemic to take care of their loved ones, right?
Paid and unpaid caregivers, that's what we like to call them. Whether or not you're getting money for it, you're an important part of this healthcare system. Burnout has been massive for years beforehand. It's even bigger now. What I really like in these prescriptions is there's several focuses on caregivers, family caregivers, making sure that they're actively engaged, that they're appreciated, that we're supporting caregivers. This is a system that depends on people who also have other jobs. And so this is something that will impact not just healthcare, it's going to impact how we treat people, how employers treat people so that they can be there for their loved ones and make sure they're getting their care that they need rather than delay and wait and watch things get worse and worse and worse.
And we saw these delays with the backlog of surgeries, Dr. Kassam, 30 months for a knee replacement, 2 years for cataract surgeries. If we don't take action, if we don't address the 5 points the OMA's identified, what would happen?
Well, patients are going to continue to suffer. Smaller problems are going to continue to become larger problems. That's not only going to make patient care more challenging, it's going to have an impact on the quality of life of individuals that we serve, but ultimately it might also cost the system a great more amount of resource. And so there are very important reasons to be able to find a path forward here. We believe that we have a roadmap and a prescription to do just that, and we're encouraged and hopeful that the political parties will adopt these recommendations into their platforms looking into 22 and beyond.
But 14 months for a heart bypass surgery, 11 months for MRIs. Are we talking about lives lost because of the backlog, Dr. Kassam?
Lives have been certainly impacted, and there may in fact be a situation where individuals may unfortunately succumb to their illness. We've seen this before, and we've unfortunately had to deal with this throughout this pandemic. Over the course of the first few waves of the pandemic, a complete reorganization of our healthcare system had to take place. Operating rooms were shut down. Wards were converted into either COVID units or non-COVID units. We had to really address some of those issues head on, and let's not forget we're still in the middle of this pandemic. And so we need a collaborative approach forward. We're calling on stakeholders to come to the table and work with us, work with doctors in order to find a path forward.
Dr. Cooper, have you seen conditions like this before in your career?
No. No, 29 years. I mean, it's been the late 90s were tough. We were really short of doctors back then. And I think there was an expansion in the 2000s. You're talking to the oldest doctor here, right? So I guess. But over the last 10 years, it's back to the way it was in the late 90s, where there's just not enough clinicians to be able to provide the work that's needed.
Yeah. Well, we'll leave it on that message there. Dr. Stephen Cooper, Dr. Hugh Boyd, Dr. Adam Kassam, we appreciate all of you making time for this conversation. Thank you.